So I'm John. I am the Joint Chief Exec of a company called Priority Digital Health. We are the partners with HCIG and the Family Hub service, and a number of other partners in here as well, including Provide. We stand for empowering patients to self-manage their health and well-being. Now, we've heard a lot today about how can we help the people in the room, how can we develop better partnerships in working together. Our mantra at PDH is patient first, or user first in the instance of the Family Hub. We do this with the right clicker by developing a single patient care record that's shared by every single one of you in order to make sure that that tell your story once mantra that we keep hearing about time and time again is really embedded with what we do across the whole of our services. Our products really then emphasize that single patient care record. We've got an EPR, which basically is electronic patient record, very much like System 1, EMIS and Vision, like you will be used to using, that sits at a higher level than all three of those and is able access for all of our community services and anybody from a voluntary sector, so they can share that product and share that whole ethos around that what tell your story once. Now, unlike some of the other services, we have a patient system as well. So our patients are included inside of that journey. So it's not just about you guys sharing information and everything else with inside yourselves, which is ultimately fantastic. It's actually about empowering the patient to take control of their own health and well-being as well. Therefore, giving them the power to make some of those massive choices and enabling them to then move forward. Has this gone off? No, it's still on. Enabling them to then move forward and start self-referring, self-managing, self-serving themselves for those areas that you can do. So obviously, today we're here to talk about Family Hubs and what Digital Hub is. A digital hub, from the very offset, is not a replacement for physical hubs. I'm not stood up here as a tech guy to say, right, I'm actually going to make all of you redundant because I'm going to make it all digital. That is not what I'm here to do, and it's not what I believe. What I believe and what we believe is that the digital hub and the digital service should emphasize what you do. It should remove some of that boring admin that you guys are doing day in, day out, replacing that with real time spent with real patients and real families. Therefore, making the maximum of what you guys are trained to do and how to deliver it by just automating loads of stuff that you don't need to worry about. Why a digital hub? Well, we've heard a lot about reaching the far communities, enhancing cost benefits. There's hundreds of reasons why you need to convert to a digital, enhance your service with a digital offer. One of the big ones is, like we said, it's time saving. We've talked about recruitment today, several times. It's really hard to recruit staff. It's really hard to train staff. Well, actually, if we'd had a digital hub put in place, that is a little piece of every one of your staff, it allows that to hold that and serve more individuals for your community easier and faster. It's open 24/7, 365 days a year. You don't have to answer emails at 2 o'clock in the morning to see that mum who's pulling her hair out because she can't get her child to sleep again. It's there, online, available, easy to access for them to get that information when they want it and how they want to consume it. Pre-COVID, trying to sell digital services into public health and the NHS was really difficult. There was barriers put up, there was warnings put up, there was scared people about opening up records and opening up this side of things to the world. COVID's changed that. We all got used to scanning in, scanning out, sharing our medical data with everybody in order for COVID to really move forward. Most of us now don't see a GP face-to-face. So let's enhance that service and allow us to have a digital version of what you guys do as well. So how do we create one? Well, to start with, we need to start thinking differently. What you do physically on a day-to-day basis and get that information out and how you do it, sending out PDFs to people to fill in and all that sort of stuff, we just need to change that. We need to think about what it is and how it would be for you wanting to access any other service outside of what you do. We don't walk. I mentioned this earlier to a group that I was talking to at lunch. 10 years ago, we used to walk into a travel agent and book us holidays. We don't do that now. We book our holidays. We go straight to booking.com. We go straight online. We do all of that online. We have changed, and we need to think differently about the way that the digital hub is pulled together and the information it delivers in order to make sure that we deliver it in the right way to the right person at the right time. Where do we start? All of these services, we were with HCRG, we started this journey probably, I don't know, Richard, 6, 7 months ago, 8 months ago. Eventually I got with the team on the ground and we started working with that. But we started with a blank piece of paper. Yes, we had the 6 years of commissioning behind us and the 6 years of physical delivery, but we started with a blank piece of paper. We went in and said, what do we want? We started with no vision. What do we want in order for now? We created a vision as to what the Digital Family Hub would be. And from there, just like this slide, we built upon it, post-it note by post-it note by post-it note, until we've developed a very integrated Family Hub offer for HCRG. And that's what you need to do. You need to come to the table with that in mind. All of the journey for all of our services at PDH, and I know with HCRG, it's service user. I hate that word. Absolutely hate the word service user. But it is who uses the service. It's the individual at the heart of it. The family who are really struggling, the family that don't know about your services, the teenager who's at school and is struggling. How do they know about your services? We have to put ourselves in every single person's shoe. We've all been there. We've all been a child at some point. We've all had ups and downs as parents, as adults, as children. We all have that experience. And I know we pulled about it on some of the panels. It's all there within us to put ourselves in that environment to understand what that is. This has to be it. If we're to develop a proper digital service, you have to put the user at the heart of it. Otherwise, it just doesn't work. And when you do, you will receive the benefits. I promise you. So some of the key features that we've built into the HCRG hub, but also some of the services and things that we should do. Full integration is obviously, and I'm going to come on to that in a minute. But some of the other things are around bookings. Booking appointments. Simple things like booking appointments, allowing a patient or an individual to find the service that they need when they need it. Notes on that individual. Shared records between different organizations and priorities. But then we start looking at more interesting things. And I know some of the panels were talking about how can we open it up to our wider audience? Well, social prescribing. It's a buzzword, with inside the service. It's been around for years. It's called outbound referrals. It really is as simple as that. It's nothing special, but that is really a real key. And it shouldn't be just for you guys to outbound refer or socially prescribe onto somebody, but you should be able to give that to the individual to find that mum and Todd walking group down the road, to find where they can do parkrun, to find, a weight management service that would suit them as an individual or as a family. They should be able to do that with inside the digital service. Being connected, as we've spoken about, and I know Richard touched on it a lot with regards to what System 1 does for HCRG, and I know that Liz also touched on it within her panel. It is key. It really, really is key. We've spent the last 6 years at PDH connecting to every single GP record in the country. It has been one hell of a journey, but that's not all we connect to. So we connect to things like pharma outcomes, we connect to community systems, voluntary sector, everything. So one record is shared by everybody. But that doesn't mean that you have to log into our system. It means that we send you data and we collect data, therefore sharing the whole record in the way that you want it to be. The difficulty with this is IG, we've talked about it a lot, but it's also around having those real conversations about thinking differently about the service. Not one individual organization needs to deliver every single intervention for the service. We can connect, we can pass on, we can really become a real hub. So, I've talked a lot about the channel. I'm whipping through this quite quickly because I know there's a lot of digital questions that Lisa wants me to answer at the end. So the family service itself, like I said earlier, we started our journey 6, 7, 8 months ago. We launched the first phase of this on 1st of February, and we are launching phase 2, part A, on the 1st of April. Well, it won't be because it's a Saturday, it'll be the Monday. But in essence, what this is a real step up in what was there before. So we've got a really integrated website that talks to the individual at the right time with the right information and at the right level of conversation. Yeah, fully accessible across all services, all units with regards to mobile, tablet devices, and has some real key features in it to enable whether you are a young person accessing the site, a parent accessing the site, you guys accessing the site for different information. Hidden behind it also is the Healthy Schools programme. It really is an integrated service across everything that HCRG do, from the West Essex specialist services to our universal services to our family school services. It is a whole system website. So some of the key features I've sort of touched on before. I'm not going to go into all of them, but online booking is one of the key things. We allow our users to access the website and book directly into services within inside the Family Hub themselves. Simple, log in, just like you would normally. Log in, put your details in, book into the service, attend. Yeah, removing some of that administration time for the users. We've also introduced our trademarked holistic assessment tool that allows a user to knows that when a user identifies that they need help but don't know what help they need or what sort of help would be available for that need, the holistic assessment and all of the algorithms built within inside it will take you on a journey of some very simple questions and answers and deliver you outcomes, referral pathways, booking options, and other things in order for you to get that support. Essex is big. We all know Essex is big. So we've geolocated all of our content within inside it. So it makes it feel like it's a local offer. Whether you're in Braintree or Harlow, you get a real geolocated family offer for your services within inside that locality. And lastly, I put age-based content here, but we've basically categorized all our content across the whole service. So whether you're looking for early intervention content or you're looking at young person content, everything is available for you at a click of a button. It's simple, it's easy to access, and that's real key for us. Some of the features that are coming down the line will be things like social prescribing. We're introducing a Essex-wide social prescribing map. In line with Provide, we also offer the Provide service, which makes it a lot easier for us to integrate this. But we will be delivering a full-blown Essex-wide integration for social prescribing. So that will have everything, like I said, from GP surgeries to parks to runs, everything all built within inside the site. Simply put in your geolocation, put in your postcode, and you'll be served hundreds of options in order for you to help with your health and well-being from, naught to, I don't want to say dead, but pretty much dead. And lastly, but not least, this has been the biggest challenge, not just from an internal battle with inside HCRG about how we do it and the complexity of the HCRG ecosystem with inside System 1, but also System 1 themselves. Anybody who's ever had to work with System 1 will understand exactly what I mean. We are fully integrated with System 1 for HCRG. So we take every single thing that's in the clinical record with inside System 1, and we output it with inside our priority platform. Everything that's put into the priority platform integrates seamlessly into the record. And that's everything from notes, bookings, ledger, accessibility, everything is through there. Safeguarding, you mention it, we have it. And I was talking earlier with Catherine, and she was like, oh, it'd be really good if you can get dads out. If the dad is linked to the child account, we can get dads out the record. So we can start really having that whole system connection throughout. I know there's lots of questions.
Now, the questions, what we've got now, we're going to put them online. We're giving you the questions, and all these frequently asked questions that people have come up with, we're going to have in one area where they'll just get one PDF with your answers, and they'll have them there in front of them for whenever they've got a problem. So can I have a big round of applause, please? Massive round of applause. Thank you very much, sir.